Sup, it's Mr. Eric, Monday, November 22nd, 2021. Check out this zombie book. This is really freaking cool, man. It feels like a zombie mask. Like, I love you. Love smacking that. It feels like one of those chickens you slap at the grocery store. You know the chicken packages, like with the thin plastic on it, and when you're a little kid, you go up and smack it, and it makes a cool sound, and it makes your fingers feel good? Yeah, that's what this feels like when you slap it. Okay, anyways, today's a hospital shift, so you know what that means? I'm not doing a day recap. Instead, I'm talking about some nursing-related topics because I have no idea. I don't remember what happened in what order today, so instead, I got some nursing topics for you. Hopefully, I can educate you on it. If you're not interested in nursing, back out the video. I don't really care. I'm doing this for myself, like I say. But if you are interested, you know, feel free to tune in. All right, so I had a patient admitted with alcohol withdrawal. Young guy, it was sad to see, but, you know, people are like that. Some alcoholics are young, some are old. You're gonna get all types of alcohol withdrawal people. However, the one thing that stays the same is pretty much how you treat it. So I'm gonna talk about how you treat alcohol withdrawal. First, you do an assessment, okay? As with anything in nursing, you always assess first. There's an acronym for nursing. It's called ADPIE, ADPIE. It stands for the steps that you do in the nursing process. A is for assess, D is for diagnose, P is for plan, I is for intervene, and E is for evaluate, which is, you know, make sure you did everything right like you should have. So, we're going to talk about assess first, the A in ADPIE. The way to assess an alcohol withdrawal patient is using something called the CIWA scale, C-I-W-A. I don't know what it means, but I think it basically means withdrawal of alcohol. And you just have a scale here, and the scale gives you a number based on different assessment questions, and that number determines how you go along with your treatment. But before I get too far into it, what is the CIWA specifically? So like I said, it's the assessment. And when you assess for alcohol withdrawal, you are looking for specific things in this patient's behavior or physiology. So one of those things is blood pressure. You are checking to see if the blood pressure is elevated. Since alcohol is a central nervous system depressant, when you're on alcohol, it makes your heart rate drop, your blood pressure drop. However, as soon as you get off it, your body gets all stimulated and brings your blood pressure up. So when somebody's been withdrawn for a while, their blood pressure gets elevated. So you are checking for blood pressure. Along with blood pressure, you are checking for heart rate. With heart rate, you are checking for sweating. So there's three things there you check for in the CIWA. Blood pressure, heart rate, and sweating. Now, there's some other things you also check in the CIWA. You check for tremors. So you ask somebody to stick out their hands, and if they're tremoring pretty bad, then they could be on alcohol withdrawal severely. You also ask them about their vision. Are they seeing flashing lights? Is the light too bright for them? Are they closing their eyes and seeing spots everywhere? Along with vision, you're asking them about their hearing. Are they hearing weird sounds? Are they hearing things that are not there? You are asking them about sensations in their body. Do they feel numb, tingling, itchiness, random creepy crawlies on the skin? Another thing you ask them about is their orientation. Do they know who they are? Do they know where they are? Do they know what the date is? Can they do a simple math problem? Because you want to check if their cognition is in place. I think there's some other things you check for. I can't think of them off the top of my head, but if you're interested in CIWA, C-I-W-A, just Google CIWA, it'll give you the whole thing. So based off all those assessment things I just mentioned, you get a score on a scale. So if somebody has like mild tremors, you can rate it a 1. If somebody has like bad, weird visions going on, you rate them like a 6. And all those numbers get added up. So once you add the numbers up, you can get like an 8, a 12, a 15. The higher the number, the more severe the alcohol withdrawal is. And that pretty much ends the assessment with that number. Once you have that number is when you go into treating the patient. Since a person on alcohol withdrawal has an overstimulated nervous system, you need to treat their nervous system. You want to calm it down. You want to bring in the parasympathetic to calm things down. And the best way to do that is with medication. Guess what medication? It is Ativan, aka lorazepam. It's an anxiety medication. It treats anxiety. This is what you give alcohol withdrawal patients on a certain schedule or as needed to calm them down. Now, how do you know how much Ativan to give? Well, you use your CIWA score. If your CIWA score is like an 8 to 12, you give them 1 milligram of Ativan. If it's like a 12 to 16, you give them 2. It depends on what the doctor's order is. After you give the ordered Ativan, you have to recheck the patient in a certain time frame. If their alcohol withdrawal is super high, if their CWA score is super high, you want to check them in like 15 minutes. If it's lower, recheck them in an hour. If it's even lower, like there's no symptoms, you don't have to check them for another 4 hours. But you're basically playing this game where you assess the CWA, you give Ativan, you reassess the CWA, you give more Ativan if need be, you taper it off if you don't. It keeps going back and forth, back and forth. The whole goal is to keep this patient's withdrawal to a minimum. So there you go. That's your education on alcohol withdrawal, CWA, and Ativan. So I had this young patient who I had to do all this stuff on. It was very interesting to me. It's actually the first time I've done a CWA intervention. So I had a good time with it, learning about the process. Unfortunately, though, this patient ended up leaving AMA. What does AMA mean? It means against medical advice. Now, patients are not locked in the hospital. If you go to the hospital, it is your choice. It is also your choice to leave the hospital. The only way you can stay in the hospital is if you're like a criminal and you have something dangerous that you plan to do and they don't want to let you out on the streets. Other than that, it is totally up to you whether you want to stay in the hospital or not. You are basically getting advice from doctors on what you should be doing. So if a doctor advises you not to leave the hospital based on your condition, you know, you don't have to listen to them. It's totally up to you. If you want to listen to them, you'll stay. Like, most people listen to the doctor because they're smart people. But if you don't want to listen to them, you got places to be, you know, you are totally welcome to leave. However, if you decide to leave like that, we have to take the responsibility off us. So we have to get an against medical advice form. You got to fill it out. And then we got to sign it, you got to sign it, put it in your chart so that there's proof to Medicare that we didn't let this person out without treating them. Unfortunately, this guy was super sick and he just left against medical advice. But, you know, it's his decision. I can't say anything about that. That's enough talk about that. If you are interested in more CWA stuff, feel free to message me. But honestly, just look it up. It's pretty self-explanatory. I'm hoping to get to tell you more tomorrow after the next hospital shift. Till then, peace.